Thank you for joining us. So my name is Beatrice Okech. I'm the Advocacy and Campaigns Manager at Transform Health. And just before we get started, this session is hosted by Transform Health in partnership with the Kenya AIDS NGOs Consortium, otherwise known as KANCO, and Young Experts Tech for Health, also known as YET4H. So our theme today is My Data, Our Health, building public demand for global health data governance framework. It is such a pleasure to see you all present today, and thank you to everyone who's also joining us virtually. So this event is centered around our recently launched My Data, Our Health campaign, and just by the sound of it, we have some exciting stuff, just for you lined up during this session. And so before we start, I'll very quickly share the session outline just so you know what to look forward to. So we'll start with a brief introduction just to familiarize ourselves with the work that Transform Health does. I'll invite one of my colleagues to come and do that. And then we'll have a first plenary discussion, just a very brief session. And then after that, we'll play a video. And then after that, we'll have another plenary discussion. And then finally, we'll get to the fun stuff, which is the launch of our filter that's really around our My Data, Our Health campaign. All right, so before we get started, I have a quick question, and whoever gets this right gets a small gift from me. So if you are in any way familiar with the work that Transform Health does, you know that we have the health data governance principles. So my question is, how many principles are there? Off the top of your head, just guess. People at the front of the table, please do not answer, at the front of the room. You're disqualified. 6? Nope. Try again. Nope. People who said 7 were really close. Yes, see me after for a gift. Okay, all right. So let's just jump right into the next part of this session. So I'll invite Tom to come and talk about the work that Transform Health does. Thank you.
Thanks, Beatrice. Good afternoon, everyone. It's really nice to see you all at the conference. I hope you are enjoying your stay in Kigali and not suffering too much of the heat. This is not usually how hot Kigali is, but we hope you're enjoying your stay. Anyway, my name is Tom Oluoch. I'm with Helena, Health Informatics in Africa. For my day job, I work for CDC, US Centers for Disease Control and Prevention. And I'm based here in Kigali, in Rwanda. So I'm very much at home. Okay, next slide. So as Beatrice said, I'm going to take you through what Transform Health is doing. I'll particularly focus on the work they're doing on health data governance and just some of the work that's happened and where things are headed. Okay. Okay, great. Yeah, thank you so much. So I'll just start off by telling you what Transform Health Coalition is about. It is a coalition of about 50 organizations that are involved in advocacy for equitable digital transformation, mainly geared towards achieving universal health coverage by 2030. Yeah, we're all familiar with UHC and as being one of the SDG goals. And Transform Health works through building partnerships and through partnerships, building consensus around those partnerships and also influencing decision makers. As we know, for the most part, when we're thinking about digital health, usually the technology may sometimes not be the problem. The problem is often around people, around networks, around politicians, around policy makers, especially policy makers who sometimes do not truly appreciate the value of digital health in transforming society and how we do business. So one of the things Transform Health aims to do is to influence decision makers by preventing evidence, and also just through advocacy to bring them on board, support these global initiatives. And also mobilizing communities, just ensuring the right communities and the right stakeholders are around the table, and that they are all fully engaged in this process moving forward. So, yeah. Okay. Yeah, so so some of the things that Transform Health is calling for at this time is, one of them is a stronger political will. Like I've said, I mean, for the most part, I mean, to achieve success in some of the initiatives that we engaged in, you need strong political support at fairly high level in various countries. And then also there's a lot of work going on in terms of ensuring that there's adequate voices calling for WHO to establish health data governance framework that's kind of global, that is hinged on equity and rights. So we'll talk a little bit more about that in detail. And then, of course, increased and coordinated investment in digital transformation. As we know, I mean, there's a lot of investment, sometimes not very well coordinated, often it's inadequate. And that's why there's this, I mean, this is also one of the key areas that Transform Health is focusing on. So Transform Health's vision is to support the achievement of UHC by 2030 by harnessing, I mean, through digital health, digital technologies, and the use of data. I mean, data, as we know, is the new gold. If I could borrow that from Phil's famous words. And the Transform Health's mission is to to build a global movement, bringing together organizations and institutions across sectors that are committed to achieving UHC in the next 8 years. Actually, now we're talking about 7 years, because we're already in 2023. So if we're looking at 2030, we're talking about 7 years now. And the core values include equity, empowerment, rights, inclusion, and partnerships. I hope I can get this to work. Oh, I think I pressed it too many times. Okay. Yeah, so so some of the questions we ask ourselves when we think about stronger governance of health data. I mean, increasingly, we know the value of our data, especially personal data, and especially in the health domain, just like in any other sector, there's increased collection and use of data. And the question is, how well is our data secure? How well is our data protected? And how much control do we have even over our own data? So, and data has become a very essential tool in decisions from different levels. I mean, whether it's at clinical care service delivery point, at policy level, you know, and in investment levels or whatever, different levels. I mean, data, they're all evidence-based and they're all built around data. And so the issue about data privacy, data ownership, and data sharing become critical. Just yesterday, there's a launch of the Africa CDC digital transformation strategy, and a lot of things talked around, you know, kind of sharing data. You think about cross-border data sharing and so on. So there's issues around data privacy and ownership, and just how we share that data and how it's accessed and what it's used for. So those issues are becoming increasingly important as we think about moving down to individual patient level information. And then rules that govern the collection and use, which are currently not in place for some countries or many countries. And then just lack of a global framework with consensus. Because again, when you talk about global frameworks or even regional frameworks, there's need to build consensus around those frameworks where there's buy-in from all the key stakeholders. Then there's growing support for a stronger health governance and increasing their voices. You'll hear, I mean, from one country to another. I mean, different countries are already working towards developing all their own data privacy and protection laws. So whether it's through legislation or through advocacy, we're increasingly hearing a lot of support growing for need for proper data governance. And then the need for international standards to harness the potential and manage the risks of health data sharing within and across borders and improve public trust. Because that's, I mean, the public trust is very critical. I mean, if you can trust like a public institution or private institution with your data, there's the element of trust that really has to be built both ways. So those are some of the things that really are behind the need for stronger governance of health data. And hence, the push for global health data governance framework. These are just some of the examples that are behind this push. Like too many times. Am I impatient? Oh. Oh, something's not right with the clicker. Okay, so I'll click. Okay. So I'm just going to talk a little bit about the health data governance principles. And as you can see, there are 8. So whoever, as Beatrice said, whoever said 7 was pretty close. So the 8 principles that have been arrived at through consensus, likely, and has had very wide stakeholder applicability. I mean, they have wide stakeholder applicability. They're built around human rights and have an equity lens. And then more importantly, they have universal health coverage at the core of it. And they're developed through a very consultative and inclusive process through 8 global, regional youth workshops and public consultation, and over 200 contributions from about 130 organizations. And so far, it's been endorsed by about 140 organizations globally. In Africa, Helena was very instrumental in working with various partners to ensure endorsement of the health data governance principles. And as you can see, the various principles, I mean, the outer ring talks about protection of people, I mean, protecting people, and then to prioritize equity and promote health. I hope it's clear enough that you can read it from the back. But if not, I can talk about, just mention them very quickly. First of all, ensure data security. I've talked a little bit about that, privacy and security. To build trust in data systems, because you want to be sure that whoever is storing your data or keeping your data, that you can trust them with how they store your data, how they transmit it, how they use it, that it doesn't cause you any harm. And if anything, it protects your privacy and ensures that it doesn't end up in the wrong hands. So the protection of individuals and communities, and then also to establish data rights and ownership. So issues around ownership are very critical. If I own my own data, then I want to be sure that I have say over it, because that's really when I can say that I own the data. And then to promote equitable benefit from health data. Where's a situation where, for example, if health data is used in research, it shouldn't benefit a segment of the society. It should really be, the benefit should be equitable across the community. And then issues about facilitating innovative use of health data. We know there's a lot of work going on around artificial intelligence and other advanced use of data to just make it more, add more value to it. And then also promote data sharing and interoperability. I think in some of the digital health sessions, they've talked about interoperability, data exchange, often based on open standards. So when you talk about data sharing, they should really be secure and based on open standards to add value to and make the data more usable. And then, of course, also to enhance health systems and services. So those are some of the 8 principles that are included in the health data governance principles. Okay, so yes, coming back to the global regulatory framework to govern health data. There's need for an agreement between countries around common standards, and then political commitment, like I mentioned, and there's also issues of accountability. We need to be accountable to the citizens. I mean, accountability is at all levels, really. And then to support strengthening of national regulation. Because with like I mentioned, and increasingly as we discuss those who are in the policy domain, there's varying levels of maturity of policies or legislation and guidelines that are around health data governance. So the belief is that with a global framework, countries, especially those that do not have their own principles, their own policies or legislation, can borrow from an existing framework and then customize them or domesticate those policies for their own use within their own countries. So, and then even for countries that already have existing legislation and policies, can still be able to identify gaps through this global framework and be able to help them to improve on their own legislation or policies that govern data. And then also look at the focus on the regulatory environment, and then the importance of a health-specific framework, because it's going to focus on health and health data governance. So it's not like a global framework that talks about data governance in general, because there's some things that are very particular to health data. So we're talking about a framework that's going to focus just on health. And then, of course, it will form a foundation of improved public trust in health data systems. Okay, so some of the key considerations for a global framework. One, like I mentioned earlier, it's guided by equity and rights-based principles, which is the health data governance. We just talked about the 8 principles, which aims at protecting people. They promote health value and promote equity. And they're based on norms and standards, including existing human rights obligations, and complement other global standards. So again, I think it's building upon global best practice and just global standards. So countries are not working in isolation. I mean, these days, whatever you implement, especially in the digital health space, you don't work in isolation because your systems are going to be interoperable with other external systems. And therefore, you need to be sure that they conform with global standards. And the same concept is applied in the development of the framework, that it builds upon and complements other global standards. And of course, it's developed through an inclusive process, which includes also civil society. I mean, civil society, as we know, I mean, usually the voice of the voiceless for the most part. And more importantly, issues around the marginalized groups, marginalized communities, which may sometimes include women in the rural areas or youths, or sometimes people with disabilities and so on. So the engagement of civil society really ensures that the voice of the minorities or the underserved are really heard and that they're taken into consideration. So the call for action at the World Health Assembly, as you all know, the World Health Assembly is scheduled for May this year. There was the executive board that sat in January for the WHO executive board that those proposals by member states to support the World Health Resolution mandating WHO to develop a framework, a global framework for health data governance. And technical briefing and side events will be convened, also just to ensure it's a bit of advocacy, also a bit of awareness creation, especially among the institutions or individuals that will be attending the World Health Assembly, to ensure there's a real common understanding around the importance of health data governance, and just be sure that is an opportunity for building, consensus, creating awareness, and also just advocating, especially if they're policy level people who make key decisions about, this kind of issues. So there's that link there that you can take a look at to get the full call for global call to action. And so far, about 150 organizations have supported the call to action to advance, for data governance at the World Health Assembly in May this year. So I think I'll stop there and hand it back to Beatrice. Thank you.
Okay, so thank you so much, Tom, for the great introduction. So we'll just jump right into the next section. So our work around health data governance gave rise to our recently launched campaign, My Data, Our Health. And this campaign aims to raise awareness and galvanize action on the issue of health data and its governance. And this mobilization campaign aims to raise the public and political profile of the issue and to start to reframe the way people think and feel about their data in a digital age. And so this will ultimately lead to greater political and public understanding, increasing demand for political action, and ultimately more effective governance and regulation of health data. And so through this campaign, we hope to bring decision makers to the table and along this beautiful journey of awareness and understanding of the potential and risks associated with health data and of the need for a common set of standards underpinned by the principle of equity and human rights. So this campaign aims to generate a public conversation and ensure political buy-in and support. And so far, we've launched the campaign in East and West Africa, focusing on 6 countries: Kenya, Uganda, Tanzania, Benin, Ivory Coast, and Senegal. So for the next portion of this event, I will invite 2 of our wonderful champions who are already engaging in this campaign from East and West Africa. And one of us will also be joining us virtually so that we can talk a little bit about this campaign and share some of the lived experiences that we're starting to hear about around health data. So welcome on stage, my friends. Can you hear me? Okay, great. So I'll just very quickly ask my friends to introduce themselves and then we can get started. So over to you.
Good afternoon. You can hear me? I'm Malin Ibrahim from Kenya, from organization, Nivalishe Pad Initiative Organization. We usually work with adolescent girls. Okay.
It's not very stable.
Okay. I'm Malin Ibrahim from Kenya. I work with Nivalishe Pad Initiative. I'm the programs manager. We work on sexual reproductive health and rights. Yeah.
Okay, my name is Spiro Falade. I'm from Benin. I'm in charge of technology innovation and prospection at One World Benin. Mostly we work in the field of sexual education, gender-based violence, and yeah, we work mainly with youth, adolescents, women, and girls. Thank you.
Okay, great. Thank you. So we'll invite our friend who's joining us virtually to say hi. Hi, Jack.
Hello and good afternoon. My name is Jack Ndegwa and I work with KANCO. We partnered with Transform Health on My Data, our health campaign. I'm glad to have joined you this afternoon. And KANCO is a consortium of NGOs that are working in health. We'll talk more. Thank you.
Lovely. Thank you so much. So we'll just jump right into the discussion, save time because, time is moving. So we'll talk about the fact that Transform Health recently launched the My Data, Our Health campaign in partnership with KANCO, and it's geared towards building this grassroots movement on the issue of health data governance. So over to you, Jack. What are some of the ways this campaign has ensured that youth, women, and marginalized people's voices are core to the campaign?
Thank you, Beatrice. Just going straight to your question in terms of the work we are doing under My Data, Our Health, we have partnered with various community-based organizations to be able to galvanize political action around health data governance issues within the East African region, that is Kenya, Uganda, Tanzania, where we are. So what we have done in conjunction or in partnership with Transform Health is that we are mobilizing and support in terms of funding to various community-based organizations from Kenya, Uganda, and Tanzania. The arrangement is that we are very careful in terms of constructing this consortium. We have organizations like Tanzania Network of Women Living with HIV, which is focusing more on women. So we had to look for organizations that have an interest in advancing the women agenda. Still on the same, looking at the marginalized organization within the configuration of this consortium. We have key populations that we are working with. The case of Kenya Key Population Consortium, working with men against AIDS youth group, MEGO, which is more focusing on issues around men having sex with men. Looking at organizations like Uganda Harm Reduction Network that have an interest with key population. These are people who use drugs. So again, looking at the question of who are some of these vulnerable or marginalized or key populations for that matter. So we have made sure that this consortium is inclusive of such community-based organization. Also, we have organizations that are taking care of youths and girls. Nivali Shepherd have just introduced themselves. We're working closely together with them within the project. We do have organizations like, Youth Alive Kenya, who are based in Kenya, working on youth issues, Girl First Initiative in Tanzania. So just in summary, is that to make sure that within the campaign, we have the voices of diverse stakeholders and community. We made sure that the consortium that is working on all these issues, inclusive of various organizations from key population, women, youths, and so on across the board. Thank you, Beatrice.
Thank you so much, Jack. So I'll just move to the next question, and I'll start with Sparrow. So from your perspective, why is health data governance an important issue for young people, and why does it need attention?
Okay, thank you for your question. I have to say, first of all, that youth and adolescents are first producer of health data. And mainly, if we like to provide some solution to the data governance, we have to include them in the process. What I mean is just like, if we like to find a solution to a problem or to a part of the population, without discussing with them, for instance, we not have a clear idea, for instance, of their need. So we have to find out why we have to work with youth and adolescents. What are their needs, and how we can actually provide the real solution to their need, actually. So briefly, that's what I can actually say.
Over to you, Malian.
Okay, 80% of youth access internet and use health apps. So I feel it is very important, and this need of improving privacy, confidentiality, and security of information use.
Yeah, lovely. And also, can we just talk about the fact that majority of the African population is young people, and they are the future, they are the present. So why not have them center their leadership and participation on such an important issue, such as health data governance?
Yeah, if you allow me. So I would like just to add also that we will all agree here that the future, the youth are the future, right? So if the youth are the future, and then we would like to provide them solutions without like inviting them at the table, it will be misleading. And mainly in the health sector in Africa, there is something that we have forgotten. I mean, through the session I went through during this AMREF conference, we have forgotten that the Africa youth are more rural than urban. So how are we building actually the bridge between the traditional health system and the modern health system will define actually the success of the framework. If you are not able to do that, I think that we merely fail. Like more than 60%, for instance, of Beninese are still going through traditional medicine, youth and adolescents actually. And more than 50% are combining both modern and traditional healthcare medicine to achieve to achieve the goal. So data are not only in the modern healthcare system, but also in the traditional healthcare system. So we have to find a bridge between those two systems to achieve the goal.
Isn't that absolutely incredible? So let's talk a little bit about the Where's My Data action, which has been a key feature of this campaign. And so while mobilizing your networks to participate in this action, what was a recurring theme from the experiences of these communities as they attempted to seek out their digital health records? Do you want me to start again?
Yeah.
Okay, sure. So this question is particularly around the Where's My Data action, that is Uson Medone.
Yeah.
And so what I want to hear from you, or what we would like to hear from you, is what was the experience like for the communities that you mobilized? What were the learnings? What was, really coming out strongly from the activity that you guys took part in?
Okay, thank you for this question. I think that during that project, during that campaign, we even do 4 or 5 videos where people give their experience about issue they face while they are attempting to have access to the data. And there are mainly 4 topics that comes out of these videos. And the first element is loss of health data. Like one of them go back to the hospital he's used to go, and then he asks for his data, to have access to his data. And the answer they give him is like, the data doesn't exist anymore. And then he has to start over. And even one of them, she lost her baby. Because of that, she lost her baby, and she was really frustrated. She even did a video in both French and Fongbe, which is actually a national language. And maybe you can have access to these videos with, Bea. And the second element is actually frustration. Like even some practitioner of health sectors doesn't understand that someone can just come to a hospital or a hospital and just have ask to have access to his data. For them, we only go to hospital when we need care, when we are ill, which is not really true. We can actually go to hospital. It is our right to have access to our data. And another element is data privacy. One of the arguments that these doctors just throw on the way is that data are private, but they forgot that those who give this data are also owner of that data. It is my data and I have to have access to it. And to finish, another topic is data security. For them, showing even your own data to you doesn't give you a kind of security. Let me explain just briefly. One of the practitioners said to one of her patients, saying that since it is the doctor who writes actually all you told him last time, he's responsible for what is in the paper. So if you show you the paper back, and then there is an error in the paper, that means that you have at least one part of the responsibility. So the definition of data security is actually what they serve as data security definition. So briefly, these are these 4 topics I would like to share with you. Thank you.
Okay.
As Nivali Shepherd, we were able to train 30 youth advocates on My Health, Our Data campaign, My Data, Our Health campaign. And we were able to tell them to go and ask for their health records to the facility they usually go. 95% were denied their records. They were told that some were given different reasons that they can't access their records because of technical error. Some were told to go to the Ministry of Health to be given a letter so that they can access their health. And 5% they were able to access their health records. Only they were asked to identify themselves so that they can be given their health records.
Okay. Thank you so much for sharing that. We'll talk a little bit about the Where's My Data action a bit later on, but now we'll move over to Jack. We'd like to hear a bit more from you. So one of the things that we've done on this campaign is also begin to engage parliamentarians on this issue, because it's really important to have, our legislators engaged on this. So Jack, why is the need for improved health data governance critical, and what role can and should parliamentarians play to advance this agenda? And what do you think we would need to be successful?
Thank you, Beatrice, for that question. One, we know for sure it is very important that we engage our policy and decision makers around health data governance issues at the country level. One, members of parliament have 3 roles that we all know. There's a question of the budget, is the aspect of legislation and the question of oversight. So no, any issue related to health data governance, whether it's on oversight, whether it's on legislation, falls squarely on members of parliament. That's why it's important at the country level and also within the region that we are in, we engage members of parliament on these issues. The starting point will be one, educating them on the various issues, the gaps at the country level, and what definitely they can be able to do at the country level. There's also another, at another level, the issue of then getting them at a higher level. How do they take this discussion beyond the work that they are doing at the country level? Like we're talking of within the East African region, we have EALA. Moving beyond that, we have the African Union, Pan-African Parliament. So there is the whole aspect of engaging members of parliament, looking all the way from legislation, certain, if you look at the environment, there are certain countries that may have weak governance, you know, on data, on digital health and data related issues. So members of parliament becomes very key in that. There's also an issue that has been raised around inadequate investment again on health data and digital health and all that. So the members of parliament are very key in giving us solutions to this issue. That's why, especially in our context in Kenya, we've been very, very key in engaging two key committees, the health committee being key in all these, and also the budget committee moving forward. Thank you, Beatrice.
All right.
Yeah.
Thank you so much, Jack. So as we've mentioned, it's really great to have, you know, parliamentarians on board, but also it's really important to have, you know, the governments brought into this issue. And so today we have a couple of representatives from, you know, various governments. And I would like to invite our speakers to, for them to answer this very specific question. What action would you like to see governments take as relates to health data governance?
Okay, thank you for this great question. First of all, as we are talking about data, there is a reality we can't ignore. When you didn't own data, you didn't own policies. And when you didn't own policies, you didn't own development. And at the end of the day, you become a toy for investors. What I mean is this: as African, we have to provide global public health goods for all, and we have to avoid free riding. It is important to ask for help, but we have to come at the table with something, at least $1 more than the one who helped us. Because 51% is more than when you are in a firm and then you own 51% of the action, you can decide. But when you just own, this 1% or 2% of difference give you the power. But if you don't own that 2%, you lose. And it is what we are going through in our continent, actually. We didn't own our data because the data collection is financed by maybe Europe, USA, and all that stuff. And when I give money for data, I have to be, you know, I have the power of this data. The second element is we have to manage externalities across sectors. We cannot decide, for instance, to build a framework for health sectors by just considering the health sectors. The health sector is linked to many other sectors. First of all, education. We are talking about digital elements. When we don't have a population which is really educated, formally educated, and don't have at least a certain level of digital education, what we are suggesting will fail at a certain point. So we have to think about it. A third element, we have to promote solidarity. Solidarity between, countries, and solidarity between countries and populations. And another element is inclusivity and awareness. Inclusivity at different points. First of all, are disabled people considered, for instance, in all things we are doing? Are not educated people considered what we are doing? So government have to think about it. And at the end, we have to be aware of something. There is a difference of tradition and culture between and within countries. And this element has to be considered. And I will come back to the first point I already enumerated, is that in Africa, traditional healthcare system is still alive. And I'm not saying that the traditional healthcare system is better than the modern one, but I'm just asking to each of us here that we have to find a way to put these two sectors together. And I think that it will be one of the main key in achieving a more impactful and effective, global health framework. So thank you.
Over to you.
Okay, 98% of the public don't know the importance of health data governance. I'll request the government to create awareness of health data governance, and also to make easy for individuals to access their data, to create a board that can regulate health data, and to campaign for international frameworks for data governance, which will help in guiding the use and management of data across within and outside the countries. Yeah.
All right, thank you. So Jack, are you still with us?
Yes, I am here.
Okay, over to you for the final question.
Beatrice, would you mind just bringing up the last question?
Sure. What action would you like to see governments take as relates to health data governance?
Oh, thank you. Thank you. Quite a number of issues. One, the question of data privacy and protection laws, as mentioned earlier on, this becomes one of the areas that our governments needs to focus on. We still have a lot of within our context, the Afro region. Within the health data governance law, we still have a lot of issues and gaps when it comes to data privacy and protection related legislations and framework. This is an area that really our government can do better. The other issue is on what we mentioned earlier on, what I refer to as growing support, especially from the decision makers and the political class around health data governance. That becomes very, very key to be able to improve our health data governance framework across the board. And I think my last point on the same is just to see what our government can possibly do more in terms of making sure that key drivers on aspect around digital adoption, especially at the country level, they are well enhanced and there is support for that. And also along the way is also making sure that the governance, what I mentioned earlier on, the investment within the health data framework, the governance of all that is getting support from our government. And I think my last one is where we are headed, the World Health Assembly, like we mentioned earlier on, come May. Are we going to see our government, coming in and supporting the health data governance agenda? Are we going to see more African countries willing to co-sponsor either a resolution together with our players, with other countries, to make sure that this becomes a key part of the agenda within the World Health Assembly? So there's a lot or a couple of areas that our governments can come in support of this agenda.
All right, thank you so much, Jack. So as promised, we're back to the issue of where's my data, which is a very interesting and also exciting campaign action that we began. And so what we were trying to do was to personalize the complex issue that is health data governance. And we invited these organizations, some of them represented here today, to mobilize their supporters and their networks to go out to their healthcare centers, to their local health providers, and to try and access their electronic health data records. Our goal was simple, but also ambitious. And we wanted to provide these organizations and individuals with lived experiences on the issue of health data that they could use not only for their personal knowledge, but also in their government and media outreach. And so from this, we've compiled a video that we would like to share with you, just so that you can learn a little bit more about the Where's My Data action and ultimately My Data, Our Health campaign. So over to the IT team. All right, just to give the team a little bit of time. So just a little bit of context as well on the issue. So as mentioned, we have piloted this campaign in 6 countries, West and East Africa. And so we're partnered with about 14 organizations from each region to participate in this activity, in this campaign. And so today you will get to hear just a few of the voices that we've collected so far on the issue. So yeah, enjoy the video.
How much control you had over your health data?
Hello, my name is Apetrida Paul, and I'm from the United Republic of Tanzania.
My name is Shannon, and I live in Ontario, Canada.
Hello, everyone. My name is Grace Njero. I'm from Kenya.
So today, I'm going to find out how easy or difficult for me to get my data records.
As part of my data, my health campaign. So let's see how it goes.
Where's My Data is an action for the My Data Our Health campaign, where people went to their health centers to ask for their medical records. Here's what they found.
I've arrived at the hospital now, and I want to see if I'll get my health records.
I'm at the entrance of the health center, and I'm hoping all the results they are giving me, they'll be well.
Some were given access to their records.
It was a quite easy process, like 5 to 7 minutes. I had the report at hand.
Actually, told me to wait so that she can go access the files for my baby's records, but I was lucky to get them. After 10 minutes, I was with my records. Were ready with me.
I'm happy that now I know I can easily access my health records anytime that I want.
For my outpatient data, looks like it's pretty much safe, and I can access it anytime.
Here in this flash drive, actually I have my records, something which is very, very smart and very digitalized.
Those were the records.
The results I wanted, but they told me to give them a letter from the Ministry of Health, showing them permission to give me my record. They are afraid to be sued.
I was told that I have to give a valid reason for me to get my data. So I had to go back home.
I was not able to access my health records. I was told to bring a letter from the high office.
J'ai demandé avec une procédure de dossier médical. Mais puis ma grande surprise, cette dernière m'a expliqué que je n'avais pas accès à mon dossier. Seul mon corps médical est autorisé.
He told me that currently I'm unable to access my health records, and therefore I needed to get a letter from anyone or any organization that needs it.
I was not given a record. I was asked so many questions, and still they did not find my record. Guys, it was time taking.
Some found that it was a very complicated process.
The pharmacist told me that you can't get health records. All your health records, you have to get, if it's the lab, you need the lab, if it's consultation, good consultation, if it's pharmacy, you will get them from pharmacy. My experience was confusing since when I went to the receptionist, he didn't know what I was talking about. I think I was the first person to ever ask for health records in that hospital.
She told me that
ça m'a choqué un peu parce que c'est quand même l'hôpital que je fréquente très souvent. Chaque fois quand je vais partir à l'hôpital, on va me vendre une nouvelle carte et les informations ne seront pas du tout organisées comme cela se doit. Et donc, je pense que ça pose un sérieux problème déjà par rapport à la gestion de nos données de santé.
I quickly found that my electronic health record is broken into various specific types of information held by 6 different bodies. In order to actually access those records, I need to provide not only my personal details, but also the type of tests and the dates of tests that I'd had in the past, which was difficult to know without access to the records. So without the records, I couldn't really access the records.
I think with the era of digital health, accessing your health record should be easier to get, and you really don't have to go through those messages.
The majority of the people still struggle to access their health data information, creating challenges for them to access treatment or better health services for them and their loved ones. I therefore advocate for My Data and iHealth campaign for all, so as we can all have access to better health data and be able to save lives.
We should have control over our health data, how it's being stored, managed, used, and disposed of. Effective health data governance would ensure that our health data is safely stored and shared, keeping us safe as individuals while also improving our collective well-being. My Data, Our Health is a global campaign to educate and mobilize the public about their personal health data and the need for it to be governed. This ensures that their data can be safely used to improve health for all. Find out how you can get involved at bit.ly/mydataourhealth.
All right, thank you so much. That was interesting, wasn't it? Thought-provoking as well. All right, so I'm happy to let you know that this video is going to inform the next part of our discussion. So I'll invite our next speakers and Caroline as well, who will be moderating this section of the panel. So, all right, thank you so much.
Thank you, Beatrice. As you said, a very thought-provoking point to join this conversation. And for us to have this conversation, I have a panel of very eminent speakers, and I will invite them to join me. I will not give you their bio. I will ask them to do that when they're on the podium. So Jean Philbert from Africa CDC, Silvere Mugumya from Rwanda Ministry of Health, Dr. Ruth Belachu, from the Ministry of Health in Ethiopia, and Pap Guy, who is the founder and president of Baobab Institute for Health and Development. But before I go to my panel, I have a question for all of you. How many of you have been to a health facility to ask for your health data? Who wants to share the experience? How did it go? I saw a couple of hands there. I saw a hand here. We have a hand at the back.
Well, a few months ago, I had a cast put on my leg after an injury, and the facility where the cast was put on closed between the time that I had it applied and the day that I was due to take it off. So I only realized that when I arrived at the facility, now I needed to go to a different place to get it taken off, but I didn't have any of my records and no way of even accessing them. And actually, I must give credit to colleagues, no, not colleagues, but people I just called. I randomly called the Ministry of Health and someone actually helped get in touch with the facility, get those records, which I then took to a different hospital. But it was quite a process and definitely made me realize how much easier things would have been if I'd had a patient-centered device or tool that captured all my information.
I saw a hand here. Yeah.
So I'd gone for a medical check for insurance purposes. And after the tests, I then requested to have my results. And I was referred to this insurance company, and I was told that I cannot access my data and that it has to go to the insurance company only, and that I'm not allowed to access it. So I very much relate to the video, even if I feel like I'm coming from a privileged position of having insurance, but I could not access my data.
Mm-hmm. Any other experience from the floor? There's one at the back.
I got the data I was looking for because I had a doctor's reference. So it kind of aligns with the need to justify the reason as to why you need it. So, and also it was very specific data they required. So nothing new here.
And there's one hand at the back, at the very back.
Thank you very much. I'm Elizabeth Wanyirigira. I'm the Health System Strengthening Advisor for USAID Rwanda, and I'm also the health person. I will share a few examples of how I was able to use digital for getting services from the facility. One time I sent my grandma to my mom to the facility, and of course, it's different from your question. You asked our experience, but that's part of the experience I want to share. Then I was not able because I was busy. I couldn't get time. Then I asked the driver, I'll take her to the hospital. Then, my mom, I don't have my lorry. I said, no, you go and I'll pay. They went, they got services. Then when they line up for payment, I went digital. I asked them, can you give me the code for the facility? Then I paid. That's a good experience. At least I was able to follow her. I was able to pay, not leaving my job. That's one experience. Another experience is when I was also busy, I couldn't go and check my results. Then I called colleagues there. There is, they have numbers where you can call. Then I called, I got just my results via email. Then I was able to schedule another appointment with my doctor. You see, I didn't leave my job. I was able to follow up. That's a good experience too. Another experience, I visited the health center. Then I want to, them to print some reports showing invoices, how they reimburse facilities, health insurance, how they reimburse how they reimburse the hospitals, because the hospitals, they have to submit invoices, being verified, and of course, being paid, reimbursed. Then I asked them, can you print? Then they say, the slow connection, connectivity is a bit slow. You understand? It's an experience. We are moving fast. We are working hard. We are having a good leadership, political will, of course, but there are few challenges that remain. For example, the instability in connectivity, that's one. Yeah, again, the equipment, the computer is there, a bit old, you could see, they are not able to print, you see those equipment. And I think those are experiences that I wanted to share with you. Thank you so much.
So in this very quick survey, it seems like our sample size of 4 are reflecting exactly what we saw in the video, that for some people it was possible to get their data, but for many that there were hurdles to jump through, and there are some who didn't even get the data at all. I will ask the same questions to my panelists. Based on what are your reflections on the video? Have you had an experience where you have gone to the health facility to ask your data? What was that experience? And I would ask you to introduce yourselves as you answer that question, beginning with Phil.
Thank you. My name is Jean-Philbert Nsengimana. I'm the Chief Digital Advisor for Africa CDC. I've had also an experience. 2019, I decided to go back to school, and I was going to the US in the state of Massachusetts. They do require that you have a set of immunizations. You prove that you've been immunized, vaccinated against, I think, something like 8 or 9 conditions, including measles and, hepatitis and so on. And I know part of the information that was wanted lied within the King Faisal Hospital. So I called somebody. I didn't have to go because I knew someone there. They said, let's look into it. And then they found something, but there was no process to share health data. There is no way you can export data from the system, the platform where it is to attach to an email. It was not clear whether they are even allowed to do that. The guy who did it, did it because he had some respect for me, but I could understand also that there is no process established. So in the absence of the regulation, you don't know whether it is allowed or not allowed. Normally, without regulation, things are allowed, according to the North America way of thinking. But according to the European way of thinking, if something is not specifically allowed, it's forbidden by default. So you don't know. Long story short, I ended up getting screenshots of my data taken by phone and sent by WhatsApp. This is not something that I could go and show as a proof of vaccination. So as a result, I remember one fine afternoon, I went and took 10 injections on one day, like 5 here, 5 here. I started an entire vaccination episode for me to register for my first class. So that has been my experience. And I think what was highlighted at that time, I know things have changed. At that time, 2019, the law on personal data protection was not yet out in Rwanda. So it was not clear that I could go and request a facility to give me my data. But today that law is in place. Facilities, banks, providers are legally obliged to give people access to their data. Now, they may not have the capabilities, like the technical readiness to be able to locate the data and give it to you, but at least the law gives the right to the person to get access to the data, and you can do anything you want. You can ask them to delete it, you can ask them to transfer it. There are 9 rights attached to your personal data, and I think that's a really good story. I wish I had that problem that time. Thank you.
Pat?
Can you hear me?
Please introduce yourself.
Yeah,
Yeah.
Can you hear me? So it's interesting. I actually have an experience now that I can talk about it, because after spending 20 years in the diaspora and living in the United States, at the most basic level, I go around with my phone and I can dial, I can enter a code, and I have access to my health record all the time with all my prescriptions, etc. I was in Belgium a couple of months ago and I needed to get a prescription. They would never give it to me without it. And the guy said, just show me the thing. So I was able to just dial in right there, show them as a proof. I just returned home after living 30 years overseas. I'm back in Senegal, and I can attest that the situation I live in this thing is exactly the same that's been described in this room. There's nowhere where I can go with confidence and have any access to any data. And none of my siblings have that. I have a sister who is a pediatrician. She's even herself struggle with having access to her data. So obviously, we have lots of work to do. This is a conversation that begins the process of changing this situation. Allow me to just jump into the subject matter, which is why we're here, because the revolution needs to start, guys. Data is at the center of having a health system that caters to the individual. We are talking about people-centered health system. It's not going to happen if the people at that center don't have the basic information to request the services that they need. How can you have a people-centered health system if you cannot cater to the people that need it? And how can you as an individual ask for something that you're not in a position to ask because you don't have the basic data? So I hope we have time to come back a little bit, but I think it's important that we focus on the rationale. While this is extremely important, I am so glad Transform Health has launched this campaign. It's a powerful campaign, but we need to carry it on, and every one of us in this room needs to start the process of doing what we can to change this, because this is not a way to start. This is just, this is the beginning of what needs to be a revolution to put people at the center of the health system delivery.
Yeah, thank you very much. I'm Silver Mugumya. I'm from the Ministry of Health, Rwanda. I'm happy to be part of this conversation, and I apologize and sorry for what happened to my former boss. Yeah, of course, those are history, and it's really a reality. And what was shown in the video, it's really what we live every day. But happy that, as explained before, it's a journey and it's a revolution that we are carrying now, and we hope to get to the right journey. And I wanted to share also an experience which is the same as you shared. Of course, it happened that one time I went to the clinic, and it was like maybe it was like about 3 years that I was not attending that clinic. And they asked me, when was the last time you attended here? I said, maybe I don't even remember the time. They said, okay. So we are sorry, we have to get back on with your description. You can imagine. So they did not still have the same record, my record of that past history. So they had to start again. That happens also. You can imagine moving from one clinic to another clinic, just getting your medical record. I cannot imagine how many clinics that I have attended so far. So they may be 100, they may be maybe 200. You can imagine me moving from one clinic to another just to get my record. Just imagine they have, because they may not have. It happens that they don't have, like it happened. They had to start afresh. My record, I had to pay all the starting point. So means they have lost everything. So we are doing a lot here in the country as Rwanda. Maybe I will come back on that. And this time, I think my boss, if he comes back, will be able to give him all the records from different clinics. This time, you don't need to move from one clinic to another. I will give you maybe a very good progress where we are, where you can get just a single patient record at the national level. And even if the clinic is not still existing, you will still have your summary record of whatever happened to the past. Thank you.
Let me stick with you, Sylvain. In the previous panel, and I think in many panels that I have attended since the conference began, everybody has said that health is multi-sectoral. So today we have talked about getting our health data from the health facility. But if I was to ask you, do you know what data is being collected about you? Meaning not just the data from the health facility, but other data about you is also driving your health as an individual. Do you know what data is being collected about you? Do you know where it is stored?
Yes, thank you. Maybe if you allow, I can start from there. Yeah. The answer is really no. I think I share this answer with the audience. So we don't know what is happening to our data now, and we don't know even where they are now. And I think it is a very good conversation that we are doing now. What we are doing here as a country, we need to give you chance to know who is tampering your data. We have created what we call a single patient record at the national level. And you as a patient, you have access to the app that is on your smartphone when you use your unique patient ID that you use across the country, and you can be able to know Dr. Silver is accessing my record now, my medical record now. And you can even know who next is accessing my medical record. That's just on medical record. I understand there is a lot of data, financial data, and some other data it's being saturating. You have cards, you have different, we are using mobile phones, mobile money, and some other cashless methodologies. We don't know maybe what is happening on our accounts, of course, but we have gone far with the medical record because I know it's the very sensitive one. We are creating an app for the patient, for the citizen, for the people who are attending clinics in the country to at least be able to know who is trying to access my medical record. And then you have a right to say why this person is accessing my medical record, while I have not even attended his clinic. So that's the right we are bringing to the finger of the patient in order that he can even claim his right.
Sorry.
Thank you.
What would you say, Pap?
Yeah, I mean, Dido, when it comes to specific health, we don't know. We know that there's all sorts of data that is being collected on us because now the telephone talks to us like they know us, because they know our preferences, they know what we want to buy, they pitch to us and things like, so we know that some data is being collected on us. But when it comes to health records, I must say, I am personally in the dark about who's collecting what on me, and that, it would be nice to change that.
I mean, and when you talk about apps, and I think about my watch, I think my watch knows more about my health than me. It knows when I sleep, when I wake up.
Yeah.
It knows how many steps I walk in any given day. If I do exercise, it knows a lot. It can measure my blood pressure. I was reading just last week that Apple is now has a breakthrough that they can be able to do diabetes tests without blood using their iWatch. Right. So things are moving so fast that health data is not only being collected at the health facility, right, and it's not only being collected by health workers, and it may be collected by people you don't even know are collecting your data. So for Phil, I remember during COVID, all our data, where we have been, have we gone to church? Have we taken a flight? All that data was being collected because it is linked, to surveillance data, to health data. But we are not doing that anymore. And we are not doing that under the assumption that there is no need to do that. Where did all that data that was being collected go?
The cloud. It is in the cloud. Yeah, but geographic data, location data is a critical piece of information. Something happened. I don't know whether privacy settings of Google changed, but every month now I receive a report of my location, what was collected about me. And sometimes I get really, surprised. I didn't remember that I was at this place. I mean, this is how they give you directions when you use your smartphone to get direction to the restaurant and so on and so forth. So I don't know, even me, very conscious about the privacy and my rights, it's become almost impossible to live cut off from the rest, not leave a digital footprint of whatever you do. The shopping you do online, the places you visit, your preferences, and especially the website you visit, your history of browsing the internet, what you watch. All of that information today is almost like impossible not to leave that trail. And I think thanks to regulations like GDPR, at least they first put that thing like, cookies and allowing storage of, but they really don't give you the choice of saying no. If you don't say yes immediately, now you go into the legal agreements and so on, and it's almost like we are at the mercy of those who operate these mega platforms in terms of how they keep our data. The only recourse I think as individuals we have is to make sure that the laws and the regulations are in the favor of the individual. And I think this is why this campaign becomes important, is to really double click on those data custodians. So when I started reading about the data protection law that Rwanda has published, there are categories of actors, including the data custodians. Those custodians have a lot more power than any individual. So they need to be regulated. And I think the fact that in terms of principles, the individual has that right to go and claim their data or ask it to be deleted, the right to be forgotten, which is almost now becoming a universal data right, is good. And then there are people who are good at monetizing our data. Can we get something in return? All those are conversations that need to be had. But I would say that if I have to disaggregate this whole question and problem, I think the key dimensions that are going to come out, there is going to be a legal dimension. And I think this is something that we can fix, especially with the conversation with the parliamentarians and so on. How can we make sure that at least we have the legal basis to secure people's rights to their data? That's number one. There is a technical component. When data is still in analog format on paper, there is very little you can do with that data. So all the efforts to digitize and digitalize health, I need to keep that in mind. One of the benefits is to give the power to the, like the person-centric mode of digitization, as opposed to the institutional-centric mode of digitalization. You can digitalize, have all this data available, but not to the person, but to the institution, and it becomes a bit difficult. So that's another dimension. But I think even a more important dimension addressing the demand side is the awareness and education. Do people know that this data is being collected on them? Do they care? What is the demand even for this regulations to change? So I think a campaign like this to start educating the public about their data, their information being theirs, and then raising the demand for that transparency, I think it's a very vital part of this. And then later on, wow, I mean, I consider myself as one of the educated ones when it comes to digital matters. But sometimes I also feel like helpless. So when you feel helpless as an individual, you have to have other protections in place. Thank you.
Yeah, I remember a social experiment. I think it was in 2022, somewhere in Europe. And, all of us, many of us use things like Google Map or a map app to help us as we are trying to navigate in places where we haven't been before. And what this gentleman did, he had a trolley and he put 100 mobile phones on the trolley. And he walked up and down different streets. And those streets were empty. There were no cars. Because when people were going to their app, they were seeing red, meaning that there's a lot of traffic. So they were using all other routes except where that gentleman was. And he was the only one on the road. And that just speaks to how much we trust the information that we are getting from the digital tools. And when I was looking at the video, there was also an element of trusting or not trusting the action of giving somebody their own data. What will they do with it? Why do they want it? The health workers themselves, as you say, Phil, did not know, do I have permission to do this? And if I do this and I get sued, will I be in trouble? What are some things that we can do, Pap, to build trust and enable people to actually know this data belongs to me, particularly health data, and be able to share that?
Yeah. So I think the operative word here is empowerment, and empowering ourselves and people for what's coming. Because we are clearly transitioning from one mode of doing business in global health to a new one. And we have an opportunity to contribute significantly in that. We have two choices. We can continue to be passive and passive recipient of what the system gives us, or we can be active participant. And in my opinion, that's the only option, is to become an active patient, an active person. Health, by the way, is not just cure, it's also prevention. And we are moving into an era where we should promote prevention a lot more. The best way to promote promotion is to empower people to be able to do that. And this is where the digital tool and digital ability comes in. Because remember, it's not really about digital, it's about health, and it's about access to health. And digital is the enabler. I think I think that's kind of the lesson. I think the other thing we could do is sensitize ourselves on the shift we are experiencing. Again, we are wanting to begin the process of doing global health in a world that is really, really different. It's not just about communicable diseases, and it is really about health as a necessary condition to be an active member of productive society. Our continent is on the cusp of taking off. Economic growth is a reality. You travel throughout the capitals, African capitals, you can see the energy. Health needs to be an integral and is an integral part of that. Because if we are not healthy, we cannot be giving 100% potential. So empowering ourselves and empowering our communities needs to be the thing to do. And I think that's the best action that we can do. Final point, the pioneers of the digital revolution have spent so much time collecting data. All of the tools that are available out there was all about collecting data. We were collecting data left and right. You know, people talk about these pilotitis and all of these instruments that but they are all for the purposes of collecting data. It's time to now say, what are we going to do with this data? What am I going to do with this data that's been collecting for me? So that shift also needs to happen, but it needs to come from you, it needs to come from us. That's why I am putting empowering ourselves and understanding where we're going as the key to what we can do.
Silver, from what you have said, it sounds like Rwanda has taken many steps already towards data governance. What more do you think needs to be done?
Yeah, there is, of course, a long journey that is still to be covered. What we have put in place is just the foundation. It's just the beginning. We have put there the policy. There is a data protection and privacy law that at least tells, defines who is the data subject, what is the right of the data subject, who is the data controller, who should be giving rights to what, and who is the data processor. All of these definitions shows who and what is the role of each and everyone. And you have also put in place the enabling environment in terms of technical. We have built the interoperability framework. This helps to collect the data in terms of health in all the different health information systems where they are, and then makes at least the client a unique, the subject matter who is the client or a patient unique. That's a very, very important thing. And then after that, you have made him unique. So we will help to the information that regards him in all the settings where he's passing. But the next one is very important, the emphasize and the awareness and even the implementation of this model. Because You understand, we are having private and public facilities. Of course, we are having also some data that are collected out of those settings. So currently we are trying to see if the public facilities can all be onboarded to the interoperability framework where they will be giving, will be collecting the data from the clinics. And then next we have to go for the private ones. We have created the interoperability standards, and we have created also some policies which are on the level of, we have a ministerial order that at least requests all the facilities to provide an update. If I have attended that facility, they are required to provide my update record that they have taken to the national file. And that national file, it belongs to the patient. And the next doctor, the next clinic that you attend, they will be able to consult that national file, and they have all the past history, and they can take a decision accordingly. And that data lake that we are creating at the national level, of course, we are going to make them useful with the AI and analytics, where we'll be able to predict whatever that may be coming. You can imagine if I can at least know what are the diagnoses that happened in the country maybe last week. I can know how many malaria that you have diagnosed in the country. So in that way, I can predict and say, maybe I need to have more commodities on treating malaria. I can have maybe have to prepare for something. That's where we are going. But of course, the journey is still long. At least the foundation of knowing who and what is their rights that they have, creating the interoperability layer where the systems can all talk to each other and at least build one file. We are in the pilot phase. We are having some health facilities that are doing that. So, but still, the patient needs to know that he has that right. We have the law, but they are the sensitization, just giving them the knowledge that they have that right. It's one thing. And also, we understand that we still have a gap on infrastructure in terms of smart devices penetration, where we need, because controlling what is happening on your file, so you need to have where to access it from. So you understand you need a smartphone, and we still have that also. It's a long journey, but we are at a good track. Thank you.
So Phil, you recently launched the digital transformation strategy at Africa CDC. What do you think are things that the CDC can do to support member states in this area of data governance?
A couple of things. I think at a macro level, this whole question of where is your data, and I think it's the first question you get asked by member states. I think it even came up yesterday during the conversation. The net result of accelerating digitization on the continent is a lot more data. Personal health data is going to start being produced, and countries, policymakers, but also citizens are wondering what's going to happen to our data. So I think one thing we can do uniformly is to do sort of a model data governance law or data governance framework that we can encourage countries to adopt, that gives, that provides the best, that world-class data governance framework that could be adopted by countries, that would put Africa at the forefront, because we could capitalize on the benefit of being late to the party and then really do the best thing that is available. That's number one. Number two, there are a lot of discussions around this question on data sovereignty, and it's really strategic. If data is the new gold, thanks for attribution, Tom. If data is the new wealth, countries are building protections to make sure that the data of their citizen is their wealth, right? And those protections, we see them in form of laws in different jurisdictions. The problem I see across the continent is each country in Africa is trying to do what the US has done, China has done, or Europe has done. But what we forget is that those markets are vastly bigger. And like the European Union has come together to have one law You know, China doesn't need anything else. I mean, they are 1 point something billion. India, the same. So I think one thing also that we need to do as Africa is to start defining our data sovereignty as a continent, not as a small individual market. And as we build these laws and regulatory frameworks, let's go into the spirit. Let's go there with the spirit of a single market. Finally, I think the other thing that Africa CDC can do from where we stand, to the point that PAP made on empowerment, we'll have many capacity building programs targeting professionals, policymakers, citizens at different levels. We're not going to be delivering those programs, but we have a lot of partners who are coming to us and saying, can we do this with you? So we have a tremendous opportunity to shape how these kind of programs are being delivered on the ground, and we can leverage that position to make sure that what's happening is happening in the right way. A few of the things that we can do, but again, Sylvia said it, it's a journey. We better get started, move fast, but also in the right direction.
I think, Pap, let me close with you. Phil has articulated very well the challenges in having single country framework by country. What is it that we can do to galvanize African ministries of health, African governments, to have an Africa framework for health data?
Well, I think thanks to Phil and CDC Africa, I actually think it's an incredible achievement to have a prominent organization that is so central to our health and the health of the continent take the lead in this subject. So I think we have a good start. It's a question of, are we going to be able to follow them? And are we going to be able to catch up? Because we need everybody to catch up as quickly as possible for what they've started to succeed. So I think we have a good platform. We have countries like Rwanda who are taking the lead in showing how to do it at the national level. There's a lot of respect around the continent on this country. I think we should leverage that. We should harness that. And I think there is you and what you can do coming out of a gathering like this. One of the things that might be helpful is to reframe our agenda. We need to be in an agenda of acceleration. We cannot, let me repeat, we don't have the luxury of taking 50 years to get to where we are today. We just can't. We've made some progress. We've saved some lives. We've cut extreme poverty in half, but we can do so much better, and we cannot afford to take the same time. That's why we have an obligation to embrace a new agenda of urgency and acceleration. So I think there is that mindset shift. If we can do that, if we could just have that mindset shift, that health is not just to combat disease, it's to accelerate economic progress, it's to be able to catch up with the private sector, it's all of the things that's gonna help the continent leapfrog and stuff and change that mindset. This is where the campaign, I think, gets important, because it's giving us tools, it's giving us language. This is where your strategy and what you're trying to do that's what it's doing. People are working in giving us the tools to do this. I think it's up to us now to take on the fight as a new fight. But as I said at the beginning, it is a revolution. And revolution starts with people who are willing to take the lead. So I think I want to invite each one of you. I want to thank you, first of all, for your interest in this subject. But I do want to make a call to action for you. We need to also demystify and simplify the thing, because a lot of people don't embrace digital because they're still intimidated. They see it as the business of those technicians. So we need to find a way to simplify, to demystify, and to convey that it is within reach of every one of us. The new generation, they're gonna get it. You know, kids are born now, they know the button, which button to push. It's gonna come, but we still have a little bit of a gap, generational gap and so forth, that we need to quickly, through capacity building and capacity retention. The gentleman in the plenary yesterday said how important that is. We also need to do that. But I think that's what it is. It's just committing to begin and to leverage what's been put out there by CDC Africa, Transform Health, and people who globally are trying to create this movement. Let's be part of that movement and do our part.
Thank you, Pap. I think for me, from this panel, when I started, I was unsure of what to expect. Is there going to be change? Are we going to see the same video if we had this exact exercise 1 year from now? But you have given examples in countries where data governance is already working, that you can be able to know what data is being collected and where it is. Silveira has given the example of Rwanda, which has taken great strides in ensuring that their citizens are able to access the data that they need, and the commitment from Africa CDC to support other member states to get to this stage. For me, I would leave this panel saying that I look forward to the day that my health service provider is giving me my data, teaching me how to use it, and so that I can be able to make decisions about it. I don't have to ask for it. It is being given to me. So please join me in thanking the panel and welcoming Beatrice back to the stage. Thank you.
Hello again. I hope you found that as interesting and as insightful as I did. And so now we're drawing to the end of this session, and we're about to do something a little bit exciting. We've talked about things like the cloud, which is a very abstract thing, What does this cloud look like? What does it have? What does it not have? And so now we want to engage you in something small, which is our filter. We are launching something really exciting. As we talk about empowerment, we're thinking about it as, first, let's create awareness. And then once we create awareness, we move into empowerment. And then once we are empowered, what do? We act, right? So that's what we're trying to do with this filter. So I might be having a little bit of trouble switching the slides. IT team help out. But in the meantime, I hope, okay, all right. So yeah, we're moving. So give me a second. Okay. Technology, eh? All right, so one more slide to go. I'm trying to be super patient with it, not push it. I think we're moving in reverse. My apologies. Okay. All right, so that's where we are. So as I mentioned, we're all about, moving from a point of no awareness to a point of empowerment, to a point of action. And so that's what we're trying to do with this Instagram and TikTok filter, recognizing the fact that the future is digital, and we're trying to get as many people as possible engaged in this discussion. So this is what we will be launching today just to engage more people in this campaign. And so it's really just about taking health data governance to the public. And so what we have is a gamified sort of filter where we call it the collect your health data game, which makes you question how much control you have over your data. So when you play it and you collect all your data, what are you? You're a winner, and you have all the knowledge and the control that you need. And then if you don't, if you lose your health data, which is part of your identity, is floating around on the internet outside of your control. So I will invite us to use our devices. Do we have our phones on hand? Do we? Yes. All right. So I will project a next slide very quickly on next steps. So first things first, go to Transform Health. That is our Instagram page, and find the filter under the second effects tab. So I will be doing it as well. So that is what it looks like. And then try the tab. Do we have our phones out? Okay, our speakers, Pap, are you ready? Jean, are you ready? Caroline, it's okay, it's all right. Yeah, so there's 2 filters on that page. So pick the where's my data one. And unfortunately, I can't show you my screen while I do it, but your screen should look something like this, something blue with a tiny cloud on there, same cloud that Jean-Philbert was talking about, right? So click on the try it function, and then you can just get to it and start to play the game and enjoy the filter and use it to start conversations around health data and health data governance. Once again, really just about empowering people to take charge of their data, to ask themselves the really important questions around, what does our health data look like? Who's collecting it? Who's storing it? Who's managing it? So this is just a really fun way for us to be able to engage with this issue, especially, among our youth audience who are, majority of the African population as mentioned. So as we close out this session, I would invite you to use this filter, play around with it, visit us at booth 19, share a couple of videos with us. If you have any questions on how to use it, also let us know. But as we close out this session, just to say thank you very much for taking the time, for your interest, for your curiosity on this very important issue. And as we move, into the future, as we take action, my call to action for you is 1, engage in the where's my data action. Really go out and try and see what your health data looks like, who has it, who doesn't have it, or if you even have access to it. And even and I do know that amongst us, there are healthcare providers, let us begin to see ourselves as custodians of health data rather than the owners of it, and let the citizens and the people who, give us this health data take ownership of it as we move forward. So thank you so much. Continue to engage in the My Data, Our Health campaign. Take the Where's My Data action, and also just come and visit us at booth 19 so that we can talk a little bit more about our work around health data governance and our push for global health data governance framework. Thank you. We are done. Okay.